Humanity First Uganda, under its program Global Health, reached out to the vulnerable, needy people of Mbale and its neighboring districts with a 3-day specialized free medical camp at Ahmadiyya Muslim Medical Center in Mbale district, about 220 kilometers from Kampala, the capital of Uganda. This free medical camp served over 796 people from different walks of life from Mbale district and 7 other neighboring districts including Bukedea, Sironko, Bududa, Budaka, Soroti, and Kibuku. The camp that lasted for 3 days attracted volunteers from far and wide, most notably among whom was a rheumatologist, a dentist, and a cardiologist, all specialists from the United Kingdom. The camp served a number of people suffering from mainly mental, dental, cardiology, and rheumatology-related illnesses. A number of different medical services were also offered, ranging from ultrasonic scan, free open pharmacy, medical consultancy, counseling, and many others. Speaking to the Deputy Director Global Health, Humanity First Uganda, Abdul Mukwanga, about the medical camp, he said he was extremely humbled and grateful to the volunteers and donors for the services rendered to the vulnerable, needy people of Mbale district.
Now, Global Health basically focuses on health. We say the greatest wealth is health. So we've come here to do a specialized medical camp. And in this, we are looking at mainly dental health. We are looking at rheumatology or rheumatological conditions, and we are looking also at cardiovascular conditions. Also, mental illnesses. That is, we are in partnership with an organization called Save the Mind Uganda, which has come to also join a hand to Global Health under Humanity First.
In an explicit interview with some of the volunteers of this noble camp, this is what they had to say.
I have some previous experience from working in the Gambia, but this was definitely something that was at a completely different level. In terms of the dental element, the preparation had to start months in advance. We even had to abandon our trip that we planned in November because unfortunately there was an Ebola outbreak. But we were really keen to come, and as soon as Ebola cleared up, we made our plans again. In terms of preparation, our aim was to not only limit it to basic things, like most people end up having extractions when they're in pain, we also wanted to offer other alternatives. We were able to offer multiple treatments, and we did multiple fillings. We did extractions, which were probably close to 200, if not more, and we even did some root canal, and we did some surgical extractions. And we had some X-ray facility on site as well, which was sort of ad hoc, and we had to bring the equipment with us. For myself in the UK, I want to thank all the donors, because other than the Humanity First sort of designated sort of funds, I reached out to people I knew, and they were very generous in in their donations, and I was able to bring some equipment that people didn't have access to here.
The people of Mbale and the neighboring districts that benefited from this medical camp were appreciative to the Humanity First organization and its donors for putting up such a camp to offer a helping hand to the most vulnerable people of the community.
So I just listen this program from the radio, then I come here to get these services because I have a problem bones. So my legs swollen. This one is swollen from here, one side. So now, if after I hear this program, I said no, please let me go and getting these services.
Meanwhile, in response to the increased number of people battling with eye-related illnesses in the eastern parts of Uganda, Under its program Gift of Sight, Humanity First Uganda reached out to the vulnerable people of Budadili in Sironko district and the neighboring districts with a free eye care camp. This exercise was aimed at examining, screening and treating the vulnerable people who could not afford such services. The Gift of Sight camp lasted for 2 days, serving more than 1,700 patients with different eye infections from Budadiri and the neighboring areas. Out of the more than 770 patients that were screened, 183 patients were found with cataracts and scheduled for operations. Besides the targeted victims of cataracts, the free eye care camp also catered for patients who were suffering from other eye-related illnesses such as refractive errors, and these were offered refractive glasses. Immediate help and advice on how to combat trachoma, allergies, among others, was also offered. The director, Gift of Sight, Humanity First Uganda, Abdul Kiwanuka, expressed his gratitude for the volunteers and donors' effort in serving mankind.
I would like to say a very big thank you to our donors out there, and this is Humanity First UK, Subbalanced Africa. We have the National Initiative on Uncorrected Refractive Errors, and the different individual donors that are really helping us to extend this helping hand to such an area. Like I've said, this is Budadili Health Center for deep in Sironko district in the far eastern part of Uganda.
Speaking to some of the beneficiaries of this noble camp, these were some of their impressions.
We are grateful for Gift of Sight being funded by Humanity First. They have really helped these patients because most of them can't afford to travel to other facilities like a regional referral. So when they organize such a camp, it helps.
Nahoho Rashid Matselele, reporting for MTA International Africa, Uganda.